the Straits of Malacca, right up there near the Andaman Seas. I have on the phone lines DJ N to the A to the T to the I to the A.
Hello, A to the N to the I to the L.
What? Whoa! Hey, we should turn that into a jingle. How are you, Natia?
I'm doing good. How are you, Anil?
I'm doing great. You know, you have such a lovely, vibrant voice, and I heard somewhere, you know, word has it that you're a good singer too.
Oh my gosh.
Are you? Okay.
Oh my god.
Maybe
I'm not gonna, you know.
Maybe we can do a duet someday. What do you think?
Yeah. Maybe.
How's the weather like? I mean, we don't want it to rain in Langkawi by me singing. But how's the weather like in Langkawi today?
The weather on this island this morning looking so good. It is really bright actually, and it is really, really, really super hot.
Super hot.
Yeah.
Okay. You know,
Yeah,
it was,
how about in KL?
Yeah, you know, yesterday when I came into work, I came into work at 2, so I overheard your conversation with KG and Lisham.
Okay.
It was really hot too. I mean, I came on air, I said, you know, fingers and toes crossed, the weather stays the same, and then voila, there you have it. When I stepped out of the studios at 5, it was pouring cats and dogs.
Oh,
so
gosh.
yeah, was it raining yesterday there?
Unfortunately, no.
No.
Yeah.
Good on you guys. Good on you guys in Langkawi.
Good. No, it's really, really hot. I have to shower many times, you know, because it's just, I don't know how to say.
Really? Just to cool yourself down, huh?
Mm-hmm.
Ah, okay. Anyway, how's Christmas preparations going about there in Langkawi?
Yeah, it's going good, yeah. Over there in Senang area, the other side, because we're in Kuang, so in Senang side, yeah, there's a lot of course, decorations for Christmas Eve. Yeah.
Okay, great. You know, over here it's fantastic as well. You know, the malls, they're like competing with one another with the best decorated mall with Christmas decorations. Some malls even have come up with fake snow. You know, they've tried to make it snow in the malls as well, and our
Christmas vibe.
Yeah, Christmas vibes. Fake snow, and then you know, with that one TikTok video as well that went viral with someone recording you know, it's snowing somewhere in KL, but then it turned out it was just, you know, somebody throwing a bunch of sponges off from
oh God.
from the balcony of their apartment. But yeah, here at TRAXX, you know, just a couple of weeks ago, we had a fantastic Christmas party celebration with our listeners in Sunway Pyramid Mall.
Yeah, I saw that.
Yeah. And then last Friday, we had a great potluck lunch party with all the DJs and the producers.
Oh, nice.
We had a great time. We had a gift exchange as well. Awesome.
Wow.
Fantastic.
What did you get?
I actually got some ringgits in exchange for gifts because my Secret Santa couldn't get me anything on time. So my Secret Santa gave me the liberty. Okay, here you go. This is money for you. Anil, get whatever you want. So I'm still contemplating. I still don't know what to buy.
Cool. Oh, I think it's best to get money, isn't it?
Yeah. Anyway, Natia,
Okay, right.
Let's jump into our topic of discussion today. I'll introduce our guests. We have in the studios today Dr. Tan Seok Hong. She's the Public Health Medicine Specialist at the Disease Control Division of the Ministry of Health Malaysia. Good morning, Dr. Tan, and welcome to TRAXX.
Yeah, good morning, doctor.
Good morning, Anil, and good morning, Natia. Good morning to all the listeners of TRAXXfm.
Yeah.
Thank you very much for setting aside your time for being with us here today, Doctor. And as you're aware, and we're aware as well, we're here to talk about a very important topic, which we were once clouded by the COVID-19 pandemic, and then by the grace of the Almighty, we came out of it, and we're living life and also adapting to the new normal as well.
Yeah.
But it seems like it is slowly making a comeback, if I may say, which leads to our topic today. It's COVID-19, staying away and staying safe. So if I may, Doctor, I want to ask you our first question. Now, I'm sure our listeners would have been exposed to this, but just to refresh their understanding, if someone tests positive for COVID-19, what are the first few things that they should be doing?
Okay, so first of all, don't panic if you test positive. So now the isolation period for those who tested positive for COVID-19 has already been shortened. From last time, if you remember, it used to be 14 days, 2 weeks, and then it was shortened to 10 days, 7 days. And currently, the isolation period is actually only for 5 days. And the 5 days starts from the day of your symptom onset. So meaning if you have symptoms 2 days ago, but you only tested positive today, your isolation period will start from 2 days ago. until
From the point I started seeing the symptoms.
yes, from the point you start having symptoms. So it has already been shortened by a lot. Why it is so is because we know that COVID-19 is most infectious in the first 5 days. That is why the isolation period is as such.
Okay.
Yeah.
And have the symptoms changed, or the symptoms are still the same?
The symptoms are still the same. So you can have fever, cough, runny nose, sore throat, lethargy, muscle ache. So the symptoms are still the same. They have not changed, even though there have been new subvariants. Yes, it has been the same. And you can get COVID-19. Majority of us will get mild symptoms, but you do have a small group of people, those in the high-risk category, who can get complications or get more severe disease. So we need to protect this high-risk group.
Okay.
Okay.
Natia?
And doctor, is it necessary for close contacts to undergo self-quarantine?
Okay, for close contacts, if they don't have any symptoms, they actually don't have to quarantine. If they do have symptoms, and they need to test themselves. So if the test becomes positive, then they will become a positive case and they need to go the isolation for 5 days. But if they test negative, they can go on with their daily activities. However, we advise them to wear a face mask when they go out, when they interact with other people, especially if they are interacting with high-risk groups. Avoid crowded places, avoid places where a lot of people gather, so to reduce the risk of transmission to others.
Okay. Now, doctor, for individuals who are actually in high-risk areas, especially locations where there have been a large number of COVID-19 infections reported recently, what recommendations or precautions would you suggest for them?
Yeah, okay. So our recommendations remain the same. That is to avoid the 3 C's and to practice the 3 W's. I hope everyone still remembers 3 C's and 3 W's.
Can you refresh that for us?
Yes.
Yeah.
So avoid close, confined, crowded places, close conversation. Yeah, and for 3 W's is wash, wear, and warn. So wash your hands frequently with soap and clean water, or use a hand sanitizer, and then wear a face mask when you go out, especially when you're in crowded places. And warn means if you have symptoms, you test yourself, and if you're positive, you let your close contacts know that you have tested positive, so that they will monitor themselves for symptoms, and if they have symptoms, they are advised to test themselves for COVID.
Okay.
All right, doctor. Do you believe there is a need for additional COVID-19 booster shots? And if so, who should receive them?
Right. For booster shots, actually, even our first booster, the uptake is only about 50% so far, meaning 50% of the Malaysian population have taken their first booster. So we still have another 50% to go. And as for the second booster, it is even lower. Only 2.5% of the Malaysian population has taken the second booster so far. So we very much encourage people to go and get either their first or their second booster if they haven't, especially for the high-risk groups. So when I talk about high-risk groups, it means those who are elderly, above 60 years old, those who have comorbids, chronic conditions, and also those who have low immunity or are immunocompromised. So this is the special group that needs protection the most, and we highly encourage them to go and get themselves vaccinated, either the primary dose or the booster dose if they haven't.
Okay. All right, we're speaking to Dr. Tan Seok Hong, Public Health Medicine Specialist from the Disease Control Division, Ministry of Health Malaysia, about COVID-19. Stay aware, stay safe, and we will be right back after the song. Good morning.
Welcome back to TRAXXfm-LANGKAWIfm Face to Face Activ8. The topic for today is COVID-19. Stay aware and also stay safe. Joining us is DJ Natia from Langkawi FM. And in the studios we have Dr. Tan Seok Hong, Public Health Medicine Specialist from the Disease Control Division at Ministry of Health Malaysia. Dr. Tan, welcome to Face to Face.
Thank you.
Okay, now moving on to my next question, Doctor. Should the public be required to wear face masks, and in what situations and locations should they actually be wearing them?
Okay, so for face masks, it's actually not mandatory anymore for us to wear a face mask. However, it is still required in certain situations. So these situations are if you are positive for COVID-19, then you need to wear a face mask if you need to interact with other people. And the other situation is in health facility settings. So in the hospitals, in the clinics, because you are surrounded by patients, right? So especially for the healthcare workers and even the visitors, anyone who's interacting with patients in health facilities need to be wearing a face mask. And also in, for example, in old folks' home, in institutions, welfare institutions where there's high-risk group, then you also are required to wear a face mask. When it is highly encouraged is when you are in public settings, when there's a crowd, in confined spaces, when you are in public transportation, when you'll be exposed to a lot of people. So in these situations, it's highly encouraged for you to wear a face mask. However, it is not mandatory.
Okay, just to elaborate on that question a little bit more, Doctor, very quickly, which we are now spoiled with choices of masks.
Mm-hmm.
There are a variety of masks out there. Which sort of mask actually would give us the best form of protection, you think, in your opinion?
Okay, so for COVID-19, for the general public, it is enough if you wear the normal, what we call the surgical face mask,
Okay.
Which is the 3-ply mask. So why it's called 3-ply mask is because there's actually 3 layers of the fabric. The material that is
Right.
being used for the mask. A surgical face mask. But if in the event that you do not have a surgical face mask, actually any type of mask is also advised or encouraged. So a cloth mask and other types of masks. But of course, the best one is if you use the surgical face mask.
Okay, thank you.
All right, and doctor, right now we are on, holiday season, and then what precaution do you advise for the holiday season, particularly for those who plan to travel during this time? Especially, Langkawi, it's tourism state, and then, we have a lot of people coming in. What do you advise for them to actually, do?
Yeah, so actually the advice and recommendations is still the same, which is if you travel, if you are on holiday, whether in country or overseas, is to wear a face mask when you're going to crowded places where there's going to be a lot of people gathering. So wear a face mask, wash your hands regularly, and if you have symptoms, then stay away from places where public places, so that you don't transmit the infection to other people. So the same sort of advice that we would give locally also applies if you are traveling.
Okay. Now, in your view, Doctor, what do you think are the factors that actually contribute to the spread of the COVID-19 virus?
Okay, so now we don't have any movement restrictions anymore, right? So people are free to move anywhere,
Right.
and people are free to
No more 1 meter social distancing and so on. Yeah.
So that is one of the factors why COVID-19 has increased. The other thing is, most of us either contracted COVID-19 or had our last dose of vaccination more than 6 months or even more than 12 months ago. So there is some waning immunity, either due to natural immunity due to past infection, or immunity from the vaccination after 6 to 12 months. So that is why we encourage people to get boosted so that they can increase their immunity again. So all these factors contribute to the increase in cases. And the other thing is, COVID-19 is a virus that always mutates. It's going to stay with us. It's not going to go away. And it is a virus that keeps on mutating. So whenever there's a mutation, the virus will mutate to become more easily transmissible. But the good news is that so far we have not seen it becoming causing more severe disease or causing more deaths. So that's the good part.
Okay, so as long as we follow the 3 C's and the 3 W's, avoid close, confined, crowded places, and maintain always wash, wear, and also warn, right?
Yep.
Yes, that's a very good point. Let's jump in for another quick break, Doctor, and when we come back, we shall resume with the discussion. We are now speaking to Dr. Tan Seok Hong, a public health medicine specialist from the Disease Control Division at the Ministry of Health Malaysia, about COVID-19, and our topic is to stay aware and stay safe. We'll be right back after this song. Good morning, Malaysia.
Welcome back to TRAXXfm-LANGKAWIfm Face to Face Activ8, and we're speaking to Dr. Tan Seok Hong, Public Health Medicine Specialist from the Disease Control Division, Ministry of Health Malaysia, about COVID-19. Stay aware, stay safe. All right, Doctor, moving on to our next question. Doctor, should the public be concerned about the current rise in COVID-19 cases, and are there any COVID-19 variants of concern that people should be aware of?
Okay, so I would like to advise the public, first of all, to not panic, even though there is an increase in the COVID-19 cases. Actually, COVID-19 is going to stay with us. It's not going to go away. So we expect increase in cases from time to time. Yeah, this is expected. So don't panic. But of course, you still need to be cautious and need to practice all the prevention measures. As for the variants, the current dominant variant is the Omicron variant. It has been since the end of 2022. And now what we're seeing is sub-variants of Omicron, such as XBB 1.16, BA.4, BA.5, BA 2.86, and others. So these subvariants of Omicron, the good thing is that even though they are more transmissible, but they cause less severe disease, less complications of the disease, and less deaths. So don't have to worry too much, but we still have to protect our high-risk groups. Yeah, so please continue to practice the preventive measures.
Okay.
All right.
And
Okay.
Doctor, where can the public actually get access on information with regard to the number of cases and any other important updates, perhaps maybe places to avoid where that has been converted into a red alert zone and so on, just for the sake of this conversation? Where can they head there?
For the number of cases, actually you can access our portal, which is called KKM Now. It used to be called COVID Now, but now it's called KKM Now. So in the portal, we actually share the data on the number of new cases, number of deaths, number of hospital admissions, number in ICU, number ventilated, and also the vaccination coverage. Yeah, so the data will be updated weekly. Weekly, so you can go to the portal and you can have a look at our data there. Besides that, we also share information about preventive measures, advice on vaccination and so on in our COVID-19 MOH portal, which is covid19moh.gov.my. So you can also go to the website to have a look at all the infographics and the list of health facilities with the antiviral Paxlovid that has vaccine and so on. So these are the two main sources of information, reliable sources of information where you can access, and it's open access for the public.
So it's KKM Now. It's Now spelled as N-O-W.
N-O-W,
Okay,
yes.
and
KKM N-O-W.
N-O-W. They just need to look that up on the search engine. It'll pop up, yeah?
Yep.
Okay. Thank you.
And Doctor, is there maybe anything else that you wish to add?
Yeah, so I'd like to advise those whose symptoms, those who are positive for COVID-19, and if their symptoms worsen, they should seek immediate medical attention at the nearest health facility. Besides that, for the high-risk groups, again, I'll repeat, those who are elderly, those who have comorbids, those with low immunity, if they are positive COVID, and even if they have only mild symptoms, you don't have to wait until the symptoms worsen. For the high-risk groups, even with mild symptoms, you should go to the nearest health facility to seek medical attention. And we can give the antiviral called Paxlovid to reduce the symptoms and also to reduce your chances of developing complications from the disease. So I would like to add that as a piece of advice.
Okay. Dr. Tan Seok Hong, thank you so much for setting aside your time this Thursday morning, for coming over here to Trax and share with our listeners this very crucial information. I think they benefited a great deal. And just to recap, two things you mentioned, the 3 C's and the 3 W's, and of course KKM Now for all the recent updates, concerning the COVID-19 pandemic. Now, before I let you go, Doctor, one more last thing. Do you have a Christmas wish for all of our listeners out there? Take it away.
Yeah, so my Christmas wish is that for everyone to stay safe and stay healthy.
Okay.
All right.
Short and sweet. I like that.
Uh-huh.
Natia, how about yours? What's your Christmas greeting for everyone, Natia?
Yeah, I would like to say happy Merry Christmas to everyone celebrating. Are you celebrating, Anil?
Yeah, I am. As long as I'm in tracks, I celebrate Raya, Deepawali,
Oh yeah,
Christmas, everything. Yeah.
everything. Yeah,
Yes,
me too. Actually.
yes. Uh-huh.
So I hope that we all will have a joyous Christmas this year, and of course, stay safe, and then don't eat too much. Eat in moderation, and stay healthy, like doctor said. Yeah.
Yeah. Doctor looks very healthy as well. She's fit as a fiddle.
It
Yeah.
is. Thank you very much, doctor, for joining us. Anyway.
Yeah, thank you for having me.
Mm-hmm.
Okay, and also thank you everyone at Langkawi FM and also our main control room for helping us out to patch this feed from Langkawi, and everyone else here at Wisma Radio Angkasa. Natia, you have a lovely day, my dear friend, and
Yeah, you too.
you never know, come New Year, Lisham and I may just pop right in front of you, and
Oh,
you got to take
yeah.
us on a tour around town.
Let's go.
Bye, Natia.
All right, bye. Take care.
Take care. All right, and that was Natia from Langkawi FM, and together with her, I spoke to our special guest in the studios, Dr. Tan Seok Hong. She's the Public Health Medicine Specialist at the Disease Control Division at the Ministry of Health Malaysia. And today, Dr. Tan actually spoke to us about how we can stay safe and how we can be aware about the COVID-19 outbreak that is slowly making its appearance back in today's society. If you missed out on this conversation, worry not, you can always replay the entire conversation back via our official YouTube channel, the TRAXXfm YouTube channel. And just to preempt our listeners, henceforth, all of our interview segments will be streamed on YouTube, not on Facebook until we say so. Time on the clock, it's 11:45, which means, yes, at 12 o'clock sharp, we'll be crossing over to the RTM News Center for the 12 o'clock news flash. And then right after that, I'll be back for another brand new hour of the show with you. So until then, I'm going to leave you with this one, Susudio by Phil Collins.